Tell me what was costing 1.5 lakhs 31 years ago that costs the same today. Dr. Devi Shetty, founder and chairman of Narayana Hrudayalaya, asked this in the company's latest annual report. Dr. Shetty is a renowned cardiac surgeon and a Padma Bhushan recipient for his pioneering efforts in affordable healthcare. After having established a heart center at the B.M. Birla Hospital, Kolkata in 1989 and then the Manipal Heart Foundation at Manipal Hospitals in Bangalore in 1997, Dr. Shetty decided to turn an entrepreneur. So in the year 2000, he founded Narayana Hrudayalaya, the first 225-bed hospital located on the outskirts of Bengaluru, with focus on affordable cardiac care. But what is the need for such focus on affordable medical care? India has 1.3 hospital beds per thousand population. There is also a shortage of skilled health workers with 0.65 physicians per thousand people. The WHO standard is 1 per thousand people and 1.3 nurses per thousand people. An additional 3 million beds will be needed for India to achieve the target of 3 beds per thousand people by 2025. Further, another 1.54 million doctors and 2.4 million nurses will be required to meet the growing demand for healthcare in India. Demand will also be created on the initiatives like Ayushman Bharat, which will boost requirements for health personnel not only in larger tier cities but also tier 2 and tier 3 cities and villages. India will therefore need to increase the number of trained health personnel across various categories to achieve a ratio of at least 2.5 doctors and 5 nurses per thousand people by 2034. India already competes with Asian peers in providing cutting-edge medical procedures at a fraction of the global costs. Over the years, this edge will help Indian hospital chains like Narayana Hrudayalaya to attract a substantial number of overseas patients. Let's understand a bit more about Narayana Hrudayalaya. In 2022, Narayana Hrudayalaya operated a network of 21 hospitals, 4 heart centers and 18 primary healthcare facilities, totaling nearly 6,500 beds across India. Although built on the foundation of a single specialty, the institution has also pivoted itself into a larger format multi-specialty healthcare provider. Narayana Hrudayalaya also has 110-bed hospitals in the Cayman Islands, a British territory in the Caribbean region. So, cardiac care remains core to Narayana Hrudayalaya. It accounts for close to 45% of the company's revenues. Over the last 2 decades, the company has expanded its focus to over 30 medical specialties, including cancer care, neurology, neurosurgery, orthopedics, nephrology, urology, and gastroenterology. Before he set up Narayana Hrudayalaya, founder Dr. Devi Shetty, who is known for having been the personal physician to Mother Teresa, had to decide whether to build a not-for-profit or a profit entity. Weighing in against the former was the access to funding. Dr. Shetty believes that charity is not scalable, but a good business is. Narayana Hrudayalaya does have a business model in which operating costs are kept under tight control, and there are many facets to it. Now, hear this carefully. As an investor, it is important that you take note of some of the critical parameters for hospital stocks that I'm going to talk about right here. First, there is the average realization per occupied bed or ARPOB, an industry matrix that hospitals report and compare. This is similar to what hotels report and compare as the average room rate or ARR. Narayana Hrudayalaya has an average realization per occupied bed of 0.8 million per annum compared to 15 million of other organized private hospitals. This is primarily because the institution focuses on keeping the facilities affordable. The hospitals have more general wards than private and deluxe rooms. The latter account for only 30% of Narayana Hrudayalaya's bed inventory, and that keeps the hospital chain's ARPOB considerably lower. Even though the ARPOB is different in different regions due to its diversified presence, Narayana Hrudayalaya is able to sustain healthy operating margins. Yet another matrix where Narayana Hrudayalaya stands out is the capital cost per bed. Typically, for any private tertiary care hospital chain, the capital cost per bed is anywhere between 7 million to 20 million, depending on the location and the room configurations, amongst other factors. Narayana Hrudayalaya had an average capital cost per bed of 3.9 million in 2022. This is because of the hospital's revenue sharing basis with other hospital chains and public entities. Finally, the most important differentiating factor is the way in which Narayana Hrudayalaya compensates doctors. Instead of incentivizing doctors for the number of surgeries performed, Narayana Hrudayalaya offers the doctors and surgeons a fixed salary. This way, the company does not have to pay commissions to freelance doctors and incremental cost is saved, reducing the total expenses of the surgery. On an average, Narayana Hrudayalaya performs 150 major surgeries per day. This gives the company the economies of scale wherein the cost per surgery is reduced by increasing the number of surgeries performed per day. So, the entity has fine-tuned the surgery process into a factory production-like system wherein operations are performed quickly and effectively. With the help of task shifting, every surgeon takes up only the tasks that they are qualified to do. This way, many surgeries are performed in a row, driving the cost down without compromising the quality. Each surgeon performs 400 to 600 procedures annually. Also, bulk and centralized buying of medical equipment and medicines helps reduce cost. Now, what is the link between Narayana Hrudayalaya and D-Mart? Well, we all know how its unique cost-focused business has allowed retailing major D-Mart or Avenue Supermart, as its corporate name is, to stand out amongst its loss-making retail peers as a profitable and sustainable growth-oriented business. Similarly, I believe its business model allows Narayana Hrudayalaya to be the D-Mart of medical procedures. Like D-Mart, even with affordability as its core objective, the business model of Narayana Hrudayalaya is scalable, sustainable and shareholder friendly. Do note, this is not a recommendation on the stock but just an analysis of the business model of the company. A deeper understanding of the stock's fundamentals and valuations would be absolutely necessary before acting on it. Do consult your investment advisor if necessary. Hope you like this video. Thanks for watching.